We're recording.
Oh,
Hey, everyone.
Hi.
Welcome.
hello.
Hi.
Hello, hello, hello.
Hello.
Welcome to my
Hello.
world team. What a cool team. I'm coming in November. I'm going to Amsterdam. I got my Amsterdam team here, and then I'm coming to Bangalore, India for the first time.
Woohoo!
Yay!
Yay. And I'm doing some of the classes. One of them, which is the one that we're really going to be talking about, I think, or whatever. Who knows what we'll be talking about? Energetic manual therapy. And I'm bringing the artistry class to Amsterdam in November. And just before that, I have the fundamentals class, which I'm also doing in Bangalore, along with in Bangalore, I'm also doing a 3D body class. So I'm bringing you guys on because I know people have questions about EMT, and some of you have done it, and I'd love for you guys to share what you got from the classes. And some of you haven't done it who are hosting you, I hope you're really excited to find out more about it, but you may have questions about what it is and what it could offer for you and why would you come to this class? Does anyone have anything? I mean, for me, it's based on all these years of body work I've done with the access tools, and the body work is based on working with the fascial system. And the access tools, when I added them to my practice many years ago, what I was doing started to create results I'd never imagined were possible. And hundreds of bodies that I worked on all contributed to what this was. And in the class of fundamentals, it's really what I saw created the greatest results with the most ease, what I'm showing. And the artistry just takes it up a level. We learn skills which are simple to learn. They're not tricky things. These hands-on bodywork skills, anyone can do them. My kids can do them. They did them when they were little. But the access tools, being the question and perceiving bodies in a different way and being able to communicate with bodies and seeing the transformation that's possible is really the huge gift of this class. What I've been seeing in the last few classes has been blowing me away, surprising me every day, and I've been doing this for a long time. So the transformation the bodies are going, that what I'm seeing, like people getting taller, changing their shape, pain's going away that they've had forever, mobility showing up in their body, and this really cool side effect of the class is people are having a really hard time not listening to their bodies after the class. So I don't know if you guys, I know Anandita, you took the class with me last year in Vienna. And I know you've been doing this around, I've seen you do it in classes and stuff. So I don't know if you have anything to share about what you got from the class. And I know you invited me back, and I'm so excited to get me to come to Bangalore. So if you have anything.
Yeah, definitely, Glenna. I had done the body class before I did the EMT class. I was in Vienna for the advanced body class. And then I was like, okay, when I went to your class, I really didn't even know why I was doing it. And I was just like, okay, I just have to do it. There was no why to that. And I really thought that I had gotten body processes when I did the ABC in Vienna. And I was totally blown away with what EMT opened up for me, because with EMT, it's a different, it is still the access tools. It's different. It's still the question that we go with, that what's the body requiring, or what is the body asking for. But what you said, Lena, really changed uh, for me with the EMT, that I wasn't able to ignore what my body was asking for after the EMT class. That just completely went off the charts for me. And it's now like the body is like my dog. Like my dog keeps nagging me for whatever it wants. My body is also like that. Or maybe the attention I pay to my body, or the presence that I have with my body, is more with the EMT class. It's just exponentialized with the EMT class. And I work in the emergency, so I'm not really able to do EMT in the emergency, because I don't have that much time with patients in the emergency. But I do advise it to a lot of people with Parkinson's. I do advise it with a lot of people with fibromyalgia, and it really has worked with bars and other body processes. It has really worked, and I would really like India to have more of this, and especially people who are doing physiotherapy, who are doing any kind of physical therapy. I think this can really add to your skills.
That's cool, really cool. the ignoring the body. I don't know what that is. I keep hearing that about people not being able to ignore their body afterwards. And I'm not clear. I keep asking questions about what is this work creating that I never acknowledged. And I'm acknowledging it more and more. And indeed, she's a doctor, an emergency room physician. That's what she does. And I just love to hear that you're referring people out. And body workers, absolutely. This is something that's going to enhance everything you do. And, you know, one of my targets is to have this so much greater on the world. So I've got this world tour coming. More people around the world are going to be receiving this super amazing work. And the access tools, like you said, all the stuff, the bars, the body processes, and the energetic manual therapy work, all of it works together to create something so far beyond this reality about what's real with bodies. We were just in the 7-day. I'm going to share this really quick because it was so cool. And there was a young man who works with the horses who had been in a really severe car accident. He would have seen you in the emergency room. He fractured his skull and knocked some teeth out. And this was like 3 weeks after, and Gary Douglas, the founder of Access, brought him in and had a lot of this work on him. And he got bars, and he got body processes and facelift energies and so many different energies. And I worked on him also, and I saw how he was so changed that the people at the resort that we go to every year for the 7-day in Costa Rica are starting to call us the wizards, because what he looked like when he came in and what he looked like 3 days later was completely different. He hadn't been eating, he'd been able to eat in 3 weeks, and he could finally eat food, and his swelling had gone down, his scarring was looking much less intense, and just his whole being was different. Now, this was all the different access tools and body work and access, and including, you know, I did work on him and some other body workers that work with fascia, the fascial system, doing some SE and some Rolfing work, or advanced. This guy's not really a Rolfer. We're all working on him, but seeing how working with the fascial system and doing the energetic processes in the bars, what that can create. I've got a whole new target of starting a clinic someday with all of this work, because it's so phenomenal just so phenomenal what's possible with what we are creating on the planet. So I don't know.
Can I share something? Mm-hmm. I've been dying to share this. That's because it didn't come across my my Facebook page last year when you were here for the EMT in Amsterdam. So I found out like right after in the body class, and I knew right then and there, I was like, I'm going to do that, and I couldn't wait when to go. And I went to Dublin, of course. Right. And only a couple of weeks after that, I went on a ski trip with my kids, and I crashed big time. I crashed with like 85 kilometers an hour off the slope. So I went just over the nets and what have you, and I landed on the street. And the people that saw it, people that saw it didn't think I was gonna survive. They were like, she's dead. There's no way that she can survive this. And I was aware of what was going on, and they really wanted to be in an ambulance right away. And I was like, can somebody tell me how I came here? So I was unconscious for just, I don't know how long, not for very long. And the first thing I did was just like the first thing that happened when I got up and I was conscious again, I put my hands on my knee, found out that my thumb was really hurting. So I did a body process instantly. But the thing was that something happens, like seriously happens to your body when you do an EMT, because this was not supposed to be able, my body was not supposed to be able to come out, you know, an accident like this. It was just amazing. I only had like a concussion, and my knee was a little bit bruised, and that was like gone in no time. I mean, I wasn't supposed to be able to stand on it. I mean, people were going, he's walking out of here. And the lady from the lift thingy that actually saw me flying by and fall, she had been in shock for like 3 days until we came back, because I said, I have to go back to the lady to tell her that I am still okay, and that, you know, I'm fine, and that she can, you know, go back to sleep again at night. And she had been sleeping for 3 nights barely, until we came and said, listen, this is what's been going on. I have been to the hospital, you know, later on, but, you know, I'm okay. It's just my thumb and, you know, my head and all that. But And I was like, this is not supposed to be possible with bodies. Seriously, 85 kilometers an hour, and then just
Thank you so much for sharing that, Susan, because this is something that I come up with a lot of people ask me this, that okay, this is great for an ache or a pain, or if you're feeling out of sorts, but what happens when you're in an accident, or what happens when, say, you have something like a cardiac arrest or a stroke? I mean, what do you do then? Now, I know for a fact that my mom, she had a stroke the second time, and she had all the signs and symptoms of a stroke, but I did some clearings for her at a distance, and I asked for and this was just after my class with Glenna, and I just asked the EMT uh, everything to just contribute. I just asked everything to contribute, and when by the time she made it to the hospital, they couldn't find anything wrong with the MRI. And her there's something called the NHS score that we do for a stroke, and that score was 0 for her, and she didn't need any intervention. So it just turned out to be a transient ischemic attack, is what the doctors called it later on. But I know for a fact that just being a question and just asking these questions, even in such a medical emergency, this the quote unquote medical emergency, and as you said, Susan, in an accident situation, it changes things, and it changes things beyond the comprehension of science and this reality.
yeah.
And I would really like that to be available to people. So I'm sure we all want that. Like, that's where we are heading.
Yeah,
And
that's so
Yeah.
cool. Available to anybody who's choosing
Yeah.
yes,
something beyond this reality. There is a different communion. I think that, because I mean, if you have a broken leg, I wouldn't say go do EMT on it. There's other things I would do in that situation, going to the emergency room. But you guys sharing these stories is opening up a whole different possibility of what is being created with this class, with how you are with your body and how different you are, and how there's a generative energy of embodiment that allows you to be able to transform things in those emergency systems that this reality doesn't recognize. But
Yeah.
we've all seen it. We've all seen it, and you guys are talking absolutely about experiencing these things. And that may be something that this class is opening up as a possibility that's even greater.
Yeah.
Wow, cool, thank you. Wow, those are not.
I can't wait to do artistry. I mean,
Can I ask a
magic. I
question?
mean, yeah, Petra has beautiful stories too. That just the
Oh,
fundamentals
yes.
is just awesome. I mean, I
Yeah.
can't wait to do artistry and just go even beyond. By the way, last question, because maybe or not. Do you allow kids in EMT classes too, Glenna?
Absolutely. All access classes are open to children. They're free if they're 15 and under, and half price 16, 17. I absolutely have been teaching the Conscious Parents, Conscious Kids class for years. I have 3 kids. My kids came to all my classes, and I enjoy the energies of children. They're never as crazy as the parents think they'll be. So I absolutely encourage you to bring your kids to any classes.
Cool.
And I'm doing a parenting intro in Amsterdam, which I'm excited about, on the 12th, which you can find out more information at the accessconsciousness.com/Dr. Glenna Rice page. But I know, Monish, you have a question. Well, yeah, Monish,
Yes.
go ahead. What's your question? Then we'll get back to Petra, because I want to hear it. I know she's doing really amazing stuff with this work all over.
Very, very quickly, Glenna, thank you for this call and live. So, can you explain a little bit about the name EMT? And my second question is, are there any prereqs? Who can join the class?
Oh, good questions. Really practical questions. So there's no prereqs. I highly recommend a body process class, ours as a minimum, but it's not a prereq. There have been people that have come that have not taken any access classes. They've just seen videos and stuff online and heard about it. And actually after the class, they went right into a bars class and foundation. So it is actually, once you come to the class, more access is desired, more classes with people. So there's no prereq. Energetic manual therapy is the name of the class. I say it's not an energy, it's the name of the class, but I think the whole class is becoming an energy of its own. It's creating me now. But so the energetics of it are the access tools, how we create with bodies, the energies of bodies, which is so huge. And any of that and all of that is on this class. being a question with bodies, how you touch body, your proprioceptive awareness and kinesthetic awareness, how you perceive bodies changing, and how you can be a question to see what they're asking for, even if it's not obvious, and being patient to know that you can never force, the body has to choose. I say it's a dance with bodies, and the bodies are leading, and you have to learn to be a follower, which isn't easy for everyone, but once you become someone that follows the body's lead, magic shows up that's even greater. This body work that's on fascia, force never works. And that's a huge part of it. And anything we do with force doesn't ever work as great as we want it to.
Huh.
And then, so the manual part is the body work with your hands. You're going to work with the body and the fascial system, hands-on stuff, amazing, yummy. You get 3 days in each class to get this amazing body work that you can then do on anyone afterwards. And then the therapy part was interesting because it kind of had judgments around it when I was thinking, is that word work, therapy? But then I'm a physical therapist, so that was cute. I looked up the word therapy, and it actually is an ancient Greek word, biblical, and it means to be of service to and kind to and to nurture and heal people. So it's like, this is actually so much of what this energy is. So the older, what this actual word therapy means originally is the energy of this class, because it's touching bodies with the kindness and being of service to the bodies you work with and having that
Awesome.
kindness and generative energy. So that's the name. There's a lot to it. I like it more each time I say it. Thanks for those
Awesome.
questions.
Thank you.
Petra, do you have anything to share? And I know your English is not your first language, but you're much better than you know. But Suzanne can translate if you need any help with that.
Yeah, thanks. For a lot of years, I did body work when I started. Ik doe het in Nederlands. Ik deed heel veel lichaamswerk voordat ik voor het eerst de EMT-klas deed.
Did a lot of body work before she did the EMT class.
En daarvoor was het heel erg je best doen en resultaten en eigenlijk hard werken om iets te bereiken.
And before she did the EMT class, it was just about hard working, doing a lot of stuff, and actually like with strength, with force.
En toen ik voor het eerst bij jou de klas deed, toen was ik zo geraakt, omdat ik voor het eerst kon ontspannen.
And when she did the EMT class for the first time, like with the first hands-on work, she was really moved because for the first time she could actually relax with having hands on people's bodies.
En dat heeft zoveel veranderd in hoe ik nu werk. En ik werk iedere dag met EMT.
And it has changed so much how I work with bodies every day. And she works with bodies every day. She does EMT sessions every day. And so it changed like everything.
Do you have any? Oh, go ahead.
Als voorbeeld vandaag.
An example from today.
I worked with a lady who was going into trauma from a lot of years ago, and her body was freezing. She couldn't move around anymore. And at the moment I lay down, op het moment dat ik mijn hand neerlegde op haar lichaam.
The moment I put my hands on her body.
En het lichaam vroeg wat het nodig had.
And asked the body what it required.
At the same moment, her body was moving again.
Wow. You know, in Japan, they call this body work beyond body work. And I'm liking it more and more. There's some videos on my page where they say it in Japanese, all these Japanese ladies, not just ladies, and they say it in Japanese, body work beyond body work, and they go, woo! And it sounds very good in Japanese.
Yeah. And the funny, what I thought was, well, I don't know if funny is the right word, but what I've just found surprising and amazing, and I was wondering, whoa, how can that happen? Is that that there's so much information apparently in the fascia, not just like what the body tells us, but there's crazy information in the fascia. I mean, I have had during a session, and I do sessions with my boyfriend, and so we had four hands on EMT,
I
and
want one of
I've
those.
had. Huh?
I want one of those.
Sure, we'll be happy to give you one, Glenna, next week.
To Bangalore.
See, but the crazy thing was that the information that I got awareness of were like family secrets. There were like taboo stuff that body just delivered to me as information. I was asking questions about the information that I got from the body, going, can I ask you a really crazy question? And it was even information about a lady who had not been, I mean, that her biological dad, who she thought was her biological dad, was not her biological dad. Well, that's the information that I got from the body during an EMT class. And then you're going, whoa,
Yeah,
what is
that's yeah. So the fascia is the body. The body and the fascia are like, you can't really separate the two because fascia is everywhere in your body.
Yeah.
So the body's giving you information, and when you tap into that system or are working with that system, there's other that, like what Suzanne was just saying, there's stuff that shows up. And the beauty of the access tools is that you can be a question with it, because if you're off a little bit by what you perceive from their body, or they're not ready to receive it, that can totally mess someone up. You can stick them with stuff that they can be stuck with for years. And so many of the other modalities working with bodies that have these kind of somatic, emotional, and other stuff come up don't have the question the way we do with access to free someone from these points of views, to change their points of views, or to have no significance around this, so they can be present now, creating a future instead of creating from some past trauma or injury or secret, like you said. Those are huge things that can mess us up.
I mean, amazing how much space became available, like in her body, in her world, because she had known basically there was something off. I mean, she had known something isn't like what is going on with my mom. And I of course I just asked questions and just like, step at a time, not to like totally freak her out about, finding out that her dad, who she thought was her biological dad, was not a biological dad. So that was just step by step. I was like, okay, how am I going to go about this? And she was like, oh my God. And then the funny thing is it's the questions, it's the energy, and then you feel all that fascia going.
Yeah, you feel the body, like you said, it's space. When we have fixed points of view with our body or with anything in our reality, that solidifies things. It solidifies your body, it solidifies your reality. It doesn't allow you to see things that don't match your point of view. And this allows people to have a different possibility of more space if they choose it. Like I said, you can't force this stuff. You have to be a question with bodies. And that's a big part of what this class is the body work is not outside some stuff that anyone couldn't learn, but adding these tools to it creates something so phenomenal. And I love to hear these things. I mean, that my target is have people all over the world, and I'm hearing stories, and thank you guys. I'm so grateful. Is there anyone else that has a question? Like, I don't know, Samantha?
Yes. I mean, I planted all the questions that I wanted you guys to answer. So thank you so much for that. I'm really looking forward to all the magic that we have upcoming for the world, for our bodies. And how would, my question here is, how would EMT energies contribute to the earth? Is there something that you'd like to speak about that?
I know when we start to have a different communion and awareness with our bodies, it changes the earth. I see our bodies as little earths. We're from this earth. Every cell in our body came from this earth, not somewhere else. And our bodies are very much like the earth. So when we change our points of view, the earth totally receives differently from us and what's available, and we can receive from the earth different. I mean, many of the things that we perceive in bodies is actually the earth communicating to us. And when you start to have this different reality with your body, you can start to perceive that and start to contribute and gift to the earth what it's asking for. And this is not cognitive stuff. The earth doesn't talk with a mouth. It's really clear, but there are energies it does require, and this gives you more access to those energies so you can be something different when you walk on the planet? What if every step we took was a contribution? You know, they say our carbon footprint is something terrible. You hear about that. And what if actually every step we took was a contribution to this planet and something greater than we could imagine? And that and the Access body classes and just all of the Access tools contribute to that massively. So anything that can change how we are with our bodies and create a greater reality or communion or oneness or however you want to say, just so we can hear them better. Anything that does that is going to change the planet, because you will be walking on the planet different. You will be more of you, and what you can be and what you can create is going to be available. And we are doing
That's amazing.
Yeah, we're doing that 3-day body class in Bangalore, which is, I've been teaching that for so long and not taught many of those classes, and I still love every single one as much as I did the first one I taught. One of the most phenomenal classes for me. And it's 3 days of receiving the energetic body processes from Access. It's different from the EMT class, except that the bodies are, both classes are for bodies. That's the main thing. And there are some body processes in EMT that I share because I use them. There's some that really work very well with the EMT work. But there is a new body process that is just come out of the 7-day that is going to be in the 3-day body class. So if you're coming,
How did we get so lucky?
Oh, cool.
you get to have this process of I can't even say it.
Desertification.
Desertification.
Desertification, yes.
Yes, you guys said very well. And that's going to be in it. That's it now in the 3-day body classes. So what that's going to create with the body classes around the world that are happening, having people running that process all over the planet, what that's going to change for the planet. I don't know. I'm in San Francisco, and we had a windstorm and fires and all sorts of stuff. They turned off my power for 4 days, which was very interesting to have no electricity around me. Going outside at night and seeing the stars because there was no lights where I live. There was a peace that was quite incredible. It was also very difficult running a business from my home in between classes and having no access to internet. But I get that's already part of this change we're asking for. The earth is showing us something. And if we're aware and we have more awareness of our bodies and the earth, what can we contribute to creating what the earth is asking for? So let's see what shows up in Bangalore with the body class.
Thank you for sharing that.
Yeah, that's 3 days before the EMT. So it's the body class in Bangalore on the
22nd, 23rd, 24th.
And then the EMT classes after.
25, 26, 27.
And what are my classes in my Amsterdam team? When am I coming to Amsterdam? Like the 9th of November, 9th, 10th, 11th is EMT fundamentals. And then 12th, 13th, 14th is going to be the advanced to the artistry class, where we just go more into what this work can create.
The 100 parents go to Skids on the 12th.
Yeah. I just did the artistry class in Tokyo, and it was greater than I could imagine. It was my first one, and it was just greater than I'd ever considered it could possibly be. So what are we going to create in Amsterdam? I can't even speak to how great it was. It was just, oh my gosh. This too? I get this too? People get bodies get this too? So how does it get better than that?
How does it get better than this?
Excited about it.
I think India also needs an artistry class eventually.
Absolutely. We're not leaving her for sure.
No, I'm going to be.
No, we aren't.
The first body class was this work that I did the SC classes for years. And the very, very first one, which is kind of where this class came from, the body work was part of that class, was in Mumbai. And it showed up in I just changed I booked my flights wrong and had 2 extra days. And tons of people showed to that. So I've had big classes with this body work. And I've had EMT there now too. And of course, I'm going to have artistry in India. You guys have been supporting this work on the planet for years.
Yay!
Yay.
And there are lots of bodies in India. Only 1.7 billion.
And with no prereqs.
Well,
what is it going to take for all the bodies to choose this?
Yes, absolutely. And the class is growing. People are excited already about it. Both of the classes are. So, okay, anything else you guys want to share or add or ask me before we go?
Well,
I'm super excited.
In case people are thinking, really, do you not need any experience or knowledge or stuff like that? Really not. And my boyfriend could not be on it, but he was on it. I took him. Well, I didn't take him. I asked him, and he said yes to Dublin. It was our 5th date. He had no experience at all with body work whatsoever, massage. He'd never done anything with that. He didn't have a bars class. He just had one bar session from me, and I asked him questions, and he was a little bit familiar with the clearings, and that was all it was. And he was awesome in the class. I mean, he kept asking, going, am I really doing this? How am I doing this? What am I doing? But the results were freaking awesome on all the bodies that he did.
He was amazing in the class. You did bring him. I know that. He was.
And he's coming again.
Let me just say a little bit about that. Someone asked me that in the Tokyo class because there was some medical professionals and there was a dentist, some medical doctor, and other body workers that came to the class. So she was like, oh, I can't do this. I don't have a degree in anything. I haven't been trained with bodies, even though she'd been doing access and bars and body process for years. Recognize that if you are doing those things, or if you've been to those classes, you are working on bodies.
Yeah.
You have amazing skills. I know that people that have just had a bars class that compared to people that I used to work with, the nurses, doctors, physical therapists years ago before access, just having a bars class creates such a different awareness of bodies, and it's so much there's so much more ease presenting this work and having people receive it that have had just a little bit of the access tools and processes and body work. And those of us who, like in Indita, would be aware, those of us who've had training, we're the hardest people for me to teach. Yeah, because you have fixed points of views, you've been trained by the medical profession or whatever, not even the Western, any medical profession, Eastern, Western, Ayurvedic, homeopathic, I don't care, acupuncture, all of those have fixed points of views about the body. And to get past the fixed points of views is more work than having to work with someone who doesn't have all those from years of being trained. Because most of those professions, really what they're doing is training us not to be aware, and access is about accessing your awareness, the consciousness of everything around you without a point of view. So please, if your body's pulling you to these classes, ask what it's going to create for your future and your body's future and the planet's future, pulling to any of these classes.
Yeah. And just listen to your body. I mean, if your body says yes, I mean, really, just go. Because it would be amazing.
And for those people who have watched this Facebook till this live till this point, I would just say that at any point, just go to an access class than going to medical college. It's so much more fun.
Absolutely.
You'll have so much more results. The things that you've truly been asking for, you'll find that far more in access classes than in medical college. So quit college, please.
or use it to your advantage and keep your awareness available. Like, don't let it stop you from what you know, knowing what you know. I went back and did my doctorate after years, and I was able to actually, the access stuff allowed it to be more ease, and I didn't have a point of view about it the way I did years ago. So you can use those things to your advantage. It's not a requirement to come to these classes. You just showed up. I know you're on another meeting. Do you have anything to add, questions or anything coming in that we're just about to end? But if you have something.
I completely messed my time up. I'm late. I'm really sorry. For me, I mean, I'm so super happy that you're coming to Amsterdam and then you're going to India, and that now the artistry class is kind of blossoming and you're taking it to the next level. Because when I took the fundamentals class in February earlier this year, it really changed the way I function with my body, but also with other bodies. It opens up a space of possibilities and allows this fluidity of communication that I've never experienced with any other class or any other modality that I've ever done. So yeah, if you haven't been to a class, come.
That's so cool. That's what we were saying at the beginning. Is it?
You
you have with the body. You're hearing it again and again. What is the class creating that I haven't acknowledged? I'm going to say it again. And those of you who show up and come, you all give more information to me and open up more possibilities with bodies. So I'm grateful for everybody who chooses this and shows up and wants to create more.
And it's like
funny though, because Teresa, when you said it, I just got aware of, like you're saying, it also changes how I am with other bodies, but it
Yes.
also changes the bodies that are around you a lot. Because I just got aware, I was going, oh my goodness, but my kids are different with their bodies and more in tune and more in communion with their own bodies than before I went to the EMT. So if you want to do your, if you want to gift your children anything, do
Well,
that. Awesome. And Jordan is
yeah.
coming, by the way, Teresa.
Yay. Well, we're also in tune and aware with each other, whether you are willing to acknowledge that or not. So when you step into this, the potency and the beauty that energetic manual therapy is, then other people pick up that frequency from your body. The way your molecules change and vibrate differently because of what you're doing, then that's an invitation to other people. And I know for me personally, when I work on other people, my clients noticed a difference. Even if it wasn't necessarily EMT that I was doing on them, they were just aware that there was something different. And there's like kind of, I don't know if Glenna still uses it as her tagline, but it was like hands that dance with bodies. And it really is, it's this dance of molecular magic that is energetic manual therapy. It's just beautiful. So it's a gift to you and your body and a gift to the other bodies around you. So,
I love that. Molecular, what is it? A dance of molecular, it was cool.
Magic.
Yeah, magic with the molecules. Yeah, something like that.
Listen back.
Yeah. But
okay. Go ahead.
It is. It's that dance of, bodies talk to us all the time. And when you're willing to actually just take that time, just that second, it's not like that it has to be, hours of time, or it's just being present. And then it is this molecular dance of just complete magic with bodies. And, you give a session and it changes stuff for you too. And it's changing things for other people and their bodies. So it's like, wow, it really is a complete gift. It's beautiful. So yes, I'm very excited to be doing the artistry. Very, very excited to see where this goes and what else it can open up for me and my body and other people's bodies and everybody that wishes to choose it.
Thank you, Teresa. That's awesome.
You're
Cool,
welcome.
guys. I'm so excited to see you guys.
Awesome.
Yes. Thank you so much. We'll sign off now. This has been longer than I thought because you had such amazing things to say. I wonder who did listen to the end. Thank you.
Zen, we love your background.
Yeah.
Thank you. Your hair looks beautiful.
Thank you. All right, I'll see you guys all in a few weeks.
Bye-bye.
Next week.
Bye.
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 Bye-bye.
See you soon. Bye.